Scientific progress starts with new ideas and rigorous evidence. Scientific Session 4, Top Abstracts, showcases the most impactful research shaping the future of spine care. Curated from the highest scoring submissions, these abstracts highlight innovation, outcomes, and evolving best practices across the field. Each presentation is paired with expert discussion, challenging assumptions, adding context, and translating data into meaningful clinical insight. From emerging science to real-world application, this session highlights why research matters and how it drives us forward as we continue elevating the quality of spine care at the Spine Summit.
Please welcome moderators Drs. Joseph Alexander, Nevin Baldwin, and Aruna Ganju to the stage.
All right, so good afternoon, everyone. On behalf of my PI, Dr. Allen, and the rest of the co-authors, I'll be presenting our work on the genetic determinants of prognosis in patients with metastatic non-small cell lung cancer to the spine. So to set the stage a little bit, up to 40% of terminal cancer patients will have spinal metastases, and of that group, nearly 20% will progress to symptomatic spinal cord compression. While frameworks like NOMS include oncologic and systemic parameters that could theoretically incorporate tumor genomics, the mutational landscape of spinal metastases specifically remains poorly characterized. Genomic profiling efforts have largely focused on primary tumors, leaving metastatic spinal lesions as a blind spot in the literature. And that's really the gap we're trying to address with this study. Accordingly, our objective was to determine if specific mutational profiles in non-small cell lung cancer spinal metastases could predict overall survival. So to investigate this, we leveraged the UCSF 500 gene panel, which analyzes over 500 cancer-relevant genes from intraoperative tissue samples ordered at the discretion of the treating surgeon. The entire selection of genes is curated by a multidisciplinary committee and modified gradually as new research comes out. So here I've included a sample UCSF 500 report, which includes a list of gene alterations found in a tumor, which you can see right here, along with other characteristics such as their likelihood to be oncologic drivers. Each report also comes with a clinically interpreted summary tailored to that patient's specific mutations. I've highlighted here an example of a treatment recommendation based on genetic alteration found in this patient's tumor, specifically the EGFR mutation. So as part of the study, we performed a retrospective review of patients who underwent surgical intervention for spinal metastases at UCSF over a 7-year span. We identified 27 patients who had intraoperative tissue sent for UCSF 500 sequencing. To correlate mutational profiles with survival, we applied the OncoCast framework. OncoCast is a validated machine learning approach. It was originally developed specifically for survival certification in patients with metastatic lung adenocarcinomas. So this is an OncoPlot, visualizes the genomic landscape of our cohort. Each column is one patient. Green represents mutations, orange represents deletions, and blue represents amplifications. Genes are ordered by frequency of alteration, with the most frequently modified at the top. The most common finding were TP53 mutations. These were present in 63% of tumors in our cohort. This was followed by EGFR mutations and CDKN2A deletions, both appearing roughly 41% of the cohort. So using OncoCast, we then dichotomized patients based on survival from time of surgery into low and high risk groups. The low risk group, highlighted in blue, with 12 patients, had a median survival of over 4 years. In stark contrast, the high risk group in red had about 15 patients and had a median survival of only 3 months. So this yielded a hazard ratio of 59.2, which was highly statistically significant. To understand what drove that survival divergence, we generated this volcano plot. So alterations to the left carry lower risk, while those to the right carry higher risk. Vertical dotted line in the center is the neutral point, so mutations that neither have lower risk or higher risk would be centered around this point. Selection frequency is represented by the y-axis, points higher up, being more consistently identified across multiple runs. And then lastly, we have a horizontal dotted line up here, which marks a threshold for what alterations we consider to have reliable prognostic significance, and this was just based on prior literature. So the top left quadrant has alterations that are reliably low risk, and the top right are reliably high risk. So here we can see that EGFR mutations were consistently selected as a favorable low-risk prognostic marker in all model runs, while KRAS mutations were selected as unfavorable and high risk in 98% of runs. We also found CDKN2A deletions and STK11 mutations to be associated with poor survival. So in conclusion, by applying the OncoCast framework to our genomic data, we identified distinct survival risk groups within our cohort with dramatically different survival outcomes. KRAS and EGFR in particular emerged as sites of key driver alterations for poor and favorable prognoses, respectively. And while these findings are exploratory, ultimately, this supports the potential for integrating molecular profiling into surgical algorithms to better optimize patient counseling and management. I'd like to thank my PI, Dr. Allen, Dr. Momineni, and entire research team at UCSF for their guidance and assistance on this project, and thank you all for your time.
In this study, 27 patients with non-small cell lung cancer, metastases to the spine, underwent next-generation sequencing, which I actually had to look up, which is parallel sequencing of DNA fragments, and then the sequences are reconstructed using AI. Their mutations were characterized, and the mutations were correlated to median survival. Patients were divided into low-risk and high-risk cohorts, as we heard, based upon a machine learning algorithm. The results, mutations were very common in multiple genes. EGFR mutations were associated with a favorable outcome. KRAS, STK11, and CDKN2A were associated with an unfavorable outcome. And the machine learning algorithm model of high risk versus low risk showed excellent predictive abilities. So the strengths and weaknesses of this study, the biggest strength was a solid methodology and a completely objective handling of the data, if you trust the AI, and results followed directly from the data without speculation. The weaknesses, a fairly small sample size. The survival was obviously dependent on multiple other factors, including what surgery they had, whether there were complications, their pre-morbid status, so on and so forth. And perhaps most importantly, all the patients already had resection of their metastases, which really limits the generalizability to patients pre-resection. Brief look at the literature shows two similar studies. Giantini-Larson et al. Looked at 56 metastatic non-small cell lung cancer mutations, and he employed a very similar methodology. And Foresi et al. Looked at 119 metastatic non-small cell lung cancer specimens. They used the Takahashi score as a surrogate for survival, and they did a linear regression analysis rather than machine learning. And the results showed somewhat fragmentary, or comparing these studies, the results are somewhat fragmentary. EGFR was a positive influence on survival in two of the studies, not in the third one. And KRAS was shown to have a negative prognostic factor in the two studies it was looked at. And then you can see different studies looked at different things. So in conclusion, this is an excellent study, and it adds to our current knowledge, and is potentially clinically useful. The author and his group are encouraged to continue their work, expand your sample size, and fill in the remaining knowledge gaps, and perhaps most importantly, apply the model prospectively. Thank you.